Hi there, it's Anmol from Ginger.io. Sorry, can I get that to change? So one of the things that's worth mentioning is in addition to all the explosion in data and sensors, there's actually a transition of business models because of legislation, things like ACA across the healthcare system. So this is something we hear all the time at Ginger.io, which is of my thousands of patients, how do I know which of them need help right now? And the reason this is hard is in the traditional healthcare system, even for the high-cost, high-risk patients, the interaction with your doctor is basically episodic, which means even if you're costing thousands of dollars a month, you only see your doctor once every 3 months, once every 6 months. And what Ginger.io does is we fill in the blanks. We tell you how your patients are doing every day, every week, with much more data than the healthcare system is used to working with, so you can intervene at the right time and not only get better clinical outcomes, but also increase efficiency in the system and help everybody save money in the system. So how do we do that? Well, it turns out there's 4 billion of these devices on the planet, and they're incredibly powerful diaries of our life. They have location sensors, calling, texting, accelerometer. You know what time a person unlocks their phone and plays Candy Crush at 2 a.m. That's the sort of data we collect, millions of samples for every individual, and we build models that predict when the person is likely to be symptomatic. And the best part, you already have these devices. You're already charging them. You're already plugging them in to upload the data. This isn't something where we have to create a new device and get it deployed. It's simply an app that you install and you start once. You never have to start it again. So here's the kind of data we collect. Hundreds of features that capture these micro behaviors about your life. And I'll give you a simple example of how we go from that raw data to actual clinical outcomes. So if you think of the clinical definition of depression, it's basically, some of the markers are, you isolate yourself. You have a hard time getting out of bed. You have a hard time going to work. You don't want to see your friends as often. You don't want to communicate with people. Those are exactly the sort of behaviors you see in a person's mobile phone data. These two graphs here, the one on the left is a person's communication style, and then the one on the right is their movement. And by measuring these statistically significant changes, we predict when a person is likely to be symptomatic with their depression symptoms. So that's great. And what we've done in the last year is gone from this really interesting sort of science project to a commercial platform that's now been deployed across the healthcare system. We're about 5 to 15 times better at predicting which patients need outreach at scale. So if you're a hospital system investing tens of millions of dollars in some of these programs, we can help them work 5 to 15 times better across a variety of different disease areas. We think the stepping stone is actually strengthening that relationship, which means doctors can ask questions, they can send tips, they can send reminders. You as a patient can log in and get insights based on your data that might help you change your behavior. And on the other side, for the provider, when your nurse comes into work, he or she basically sees their dashboard. So all of your 10,000 patients with 30 need help, and what's wrong with them? You can go in and look at their data, you can make clinical decisions, you can decide to do triage or follow-up based on this sort of information. But that's just the first step, right? We're at actually a much bigger opportunity. There's a lot of expertise in this room in the fields of consumer software and design to design the next generation of interfaces that use the same passive data but deliver interventions and treatments to the app. We're doing a lot of these interesting things through things like having your friends or family members reach out to you at the right time, or sending you the funny picture that always makes you happy when you're depressed. So Ginger.io, in the last couple of years, we're now widely deployed across the healthcare system. We're live with about 20 different systems across the country. But what's even more interesting is the impact that we're having on patients' lives. So in just the last 3 months alone, we've delivered thousands of alerts which have driven either nurse interventions or in-app interventions across these institutions. I have dozens of stories, whether it's the mom with the 3-month-old baby who was suffering from postpartum depression, where we were able to intervene at the right time, or the person considering suicide, where we were able to intervene and a nurse was able to prevent that from these alerts. These are some of the examples that inspire us to come to work every day. That's what we do at Ginger.io. Happy to chat more later. Thank you.